Hi, I'm Dr. Riggleman, and I want to take just a few minutes here to go over a few things about the causes and treatment of knee pain. I have a few minutes before I have to go back to the exam room and examine a lady that has come in just for this specific problem. So I want to touch base with you on a few things here. It won't take too long. Knee problems are epidemic, really, in the United States. And over time, stress, repetitive trauma, the type of work you've done, maybe athletic or recreational activity has gradually deteriorated and damaged the knee joint. And the pain then comes slowly on. It may be in one knee and eventually become in the other knee, which is not unusual to see that. What we have is a knee joint. I'm going to bring that up there so you can get a good look at it. That's a healthy knee. You can see the cartilage under here, the ligaments, and it's good and solid. It's good and healthy. As time goes on, it begins to break down and starts to look like this. There's erosion of the cartilage, and the knee joint is wobbly, mainly because these ligaments on the side and the one in the front become weaker. They become elongated. They are not tight and firm and holding against one another like guide wires. When this happens, the stress in the knee increases. It develops more and more as time goes on, and you develop chronic knee pain. So most people then have had the typical treatment. They've maybe started out with pain medication and using ice or heat or something like that on their knee. Eventually, they've had steroid shots, maybe gel shots, the rooster comb, and it may have given them short-term relief, but over a period of time, it came back again. And research shows that particularly steroid injections will deteriorate the joints and accelerate the deterioration. So you're really working against yourself when you get more of those. And then some have had arthroscopic surgery, and they've debrided the joint and cleaned it out some. And there again, maybe some short-term relief. And then ultimately, they have a knee replacement. And people with knee replacements still going to have pain, because we know research has told us, and this study right here that came out from the University or the Royal College of Surgeons in Ireland says that at least 23% of your knee pain is neurological in origin. In other words, knee pain is driven by the nerves in and around the knee, both in the cartilage, the joint, and the soft tissue that supports the knee. So this is why patients that have had knee replacements still have pain. The majority of their pain was not from the joint itself. It was from the soft tissue, the ligaments, the tendons, and part of the muscles that support the knee. And we know that 5 of the nerve roots from the lower back, from the lumbar spine that goes down into the lower extremity, 4 of these nerve roots support and affect the knee. So you can have a low back issue that is silent. You don't have back pain, but the referred pain, it shows up in the knee. And sometimes in those patients, you have to treat the lower back as well as treating the area that hurts and where the pain is. And that's why those standard treatments that's generally given, pain medications, injections, and ultimately the knee replacement, just isn't that effective, or only short term, because the actual cause is something farther removed from the joint itself. So that's why patients are still in pain, and we see that a lot. The lady I'm getting ready to go back and do an exam with is like that. She's had multiple shots over a period of time, and it comes back, and every time it comes back, it seems to be a little bit worse. So she's decided she wants to look at an alternative, and that's what we're going to offer. So our treatment is based on several things. One, we look at the mechanics, the functional mechanics of the knee joint, the articulation, the ligaments and the tendons, and how they support it. And then we look at the neurological side. We do a sensory nerve conduction test to measure that nerve effect that's going on there, how much of it is coming from the nerves. And then the third thing we do, we check the amount of oxygen in your blood. This is grossly and too many times overlooked. And we know that that's one reason why surgery fails, is lack of oxygen availability and lack or improper or inadequate delivery to the soft tissue. So we check your oxygen and we compare upper and lower extremity. We see there's a difference, and the majority of times there's a significant difference between what oxygen is in your pinky here, your finger, and what's in your feet. And that relates to the lower extremity and the knee. And once we identify these issues, then we will know if you are a candidate for our particular protocol. And our protocol is based on several things. One is to restore the normal mechanics of your knee, to strengthen the soft tissue and ligaments and muscles that hold and support the knee and prevent that erratic movement that continues to wear down the knee joint. And we need to increase your oxygenation, your amount of oxygen. And we do that with laser, we do it with pulse magnetic frequency. We do it with a specific technique called trigenics and extremity decompression. These things mechanically and physiologically treat the knee, and then we support it with also some home therapy that we give you to use at home. And these are the reasons why we have a success rate of at least 80% with our knee patients. Now, how do you get started? Well, first thing you do is either call our office or you fill out the form at the bottom of this page and submit it. And then we will contact you and you will be given an appointment. You will come in and we will do that examination based on your particular situation. And then if we feel you're a candidate, we'll make a second appointment. And when you come back, we will go over all the things we need to do, the time frame, what the treatment specifically consists of, the type of financial arrangements we can make if that's necessary. And then we will give you or offer you 2 visits. We will include that in the exam. If you show a positive response in those 2 visits, in other words, you feel better, you function better, or both, then that is a indication to me that you are a candidate for our treatment and we would accept you as a patient. If we do not see improvement in those 2 visits, then this protocol is not for you. That is how we do it. That's what you will know in 2 visits if this treatment regimen, this protocol, our recommendations are right for you, and you will see it. It's not me telling you it's working. You will feel it. So call our office, make an appointment, find out what the first available appointment is, and fill out that information form and submit it. We'll get in touch with you and we'll get started. And hopefully you'll be one of those 80% that shows significant or total improvement in their knee function and live a healthier, happier, more functional, and active life. So nice talking with you. Have a great day.